So hi everyone, my name is Franz Jasmine Swanner Yap, your student nurse from Davao Doctors College, and today I am going to perform the open gloving. So this technique is used in a minor procedures when the only hand needs to be covered. So first is we need to check for the size of the gloves so that it is tight and easy to pick up the object, and of course let's ensure that the patient doesn't have any latex allergy prior to applying the sterile gloves. Then we need to inspect for the gloves sterility and of course remove the jewelries. Make sure that there is no artificial nail or extenders, and of course check the hand if there are any sores or abrasions. So first, let's sanitize our hands. So prepare the sterile gloves and ensure that the correct size, and of course check for any stains or tear. So remove the outer wrapper of the glove package by carefully separating and teeing apart sides. So this remains the sterility of the glove in the inner pocket. So grasp the inner package and lay it on a clean, dry, flat surface in the waist level. So the inner surface, which are next to the sterile gloves, will remain sterile. So allow the ease of the application. With the thumb and first two fingers of non-dominant hand, grasp the edge of the cuff of the glove for dominant hand. Touch only the inside surface of the glove. So by touching only the inside surface of the glove, we are avoiding to contaminate the outside. So pull carefully the glove over the dominant hand, leaving the cuff and being sure that it does not roll up to the wrist. Be sure that the thumb of the fingers are in the proper spaces. So with the dominant hand, slip the fingers underneath the cuff to the second glove. So carefully pull the second glove over the non-dominant hand. Do not allow the fingers and the thumb of the glove of the dominant hand to touch any part of exposed dominant hand. Keep the thumb of dominant hand abducted back. So we are touching the sterile only to prevent the contamination. So after the second glove is on, interlock the finger of gloved hand and hold away above the waist level until the beginning of the procedure. So these steps prevent the accidental touching of the non-sterile object or the front of the gown or the contamination. So now let's proceed to disposal of the gloving. So grasp the outside of the one cuff with the other gloved hand. Avoid touching the wrist. Pull halfway down palm of the hand. So take the thumb of the half and glove and place under the cuff of the other glove. So pull glove off and turning it out inside out. So discard in receptacle. So this prevents the contamination of the gloved hand touching ungloved hand. So take the finger of the barely hand and tuck it inside, inside the remaining of the glove cuff. Peel the glove inside and out and discard it to the receptacle. So doing this prevents the contamination of the hand when removing the glove. Then of course, don't forget to perform hand washing to prevent the spread of the microorganisms.
Na?
And that's the proper open gloving and disposal of the glove.